Hi everyone, Dr. Timothy Gallagher.
Dr. Michael Marciello.
And we're from Maragal Medical. You know, Dr. Mike, it's hard to believe it's been almost 6 years since we started doing regenerative medicine injections in our practice.
Yeah, and the science is changing all the time. It's evolving to get better and better, and then we're trying to keep up to that new science all the time.
Yeah, so I thought this week, we talked to the group about the newer types of injections that we're doing in our practice, and even more exciting, some of those covered injections. You're not going to want to miss this one, so stay tuned. Okay, so we're talking about regenerative medicine injections. We go back almost 5.5 years now. I was the first patient to get a amniotic allograft injection or stem cell injection in my shoulder, and look, we're doing really well. You know, 5.5 years after the injection. We talked a couple of weeks ago about some of the things that we do in terms of prevention. I have my PRP injection to kind of boost the effect and keep my shoulder moving. But gosh, the science continues to evolve. And in the early days, we used one type of cellular injection. Now we're using a different type of cellular injection. This would be a great opportunity to talk to the viewing audience about, the latest science breakthroughs that we're seeing with this.
Well, sure. I mean, we think about the science, the world in regenerative injection has taken on all different avenues. Different laboratories approach it different ways, try to come up with newer products, better products, and we're trying to keep abreast of that so we can utilize these materials. So we think about the way we get regenerative injections from our body, looking at the stem cells of our own bodies to repair. But when you look at the laboratory, they're creating these harvesting stem cells from amniotic tissue, as you mentioned when you first got the injection, and now getting to the little different areas of harvesting it from the umbilical cord area, so-called Wharton's jelly.
Yeah.
And we're using those type of injections now currently in our practice.
Yeah, and what's great is we've gotten to partner with a lab that's going really the extra mile for that data collection. They have an IRB with Montana State, and boy, that allows them to have this broad access to some really exciting technology and electron microscopic evidence of what we're actually trying to do. And I think for patients, it's really important to understand, and I get this question all the time, what are these injections actually doing? So I think for a patient, it's kind of tricky if you're coming in with arthritis in your knee, or maybe a partially torn rotator cuff, or maybe plantar fasciitis, or any other of the hundreds of problems that we treat, like what structurally is happening. So I think showing you the image of what damaged tissue looks like. So we'll kind of scan over to the top image. We can see how scattered, and we have gaps where there isn't tissue, and then compare that to the after effects where we're getting these cross-bridging, where we're getting repair and replacement of that damaged tissue. That's really exciting because now we're starting to see the evidence objectively as we see that.
Yeah, if we just try to keep it simple, our body has all different types of tissue, right? We have skin, we have hair, we have bones. But if we think about what's damaged, it's not working properly, or it has a defect, it's got a breakdown in it. And we're trying to simply put in good things and take out the bad. So we're replacing the bad tissue by inserting, through an injection approach, this new material, which is actually going to help repair that damage that we, get our conditions. That's where our pain comes from, because something's damaged. So we are really just trying to replace the bad with good.
Right, and that is going to translate into what? Improved function with the patient. So not only are we going to see that decrease in pain, but we're going to see that improved function, whether it's a patient that is having difficulty going up and down stairs, or the patient that is now having, some problems. They've worked hard their whole life, they're retired, they want to enjoy the grandkids or enjoy playing some golf or tennis or whatever it is, to have that ability to get their life back without the risks of going through a surgical intervention.
Yeah, so if we can kind of make that functional improvement, so we're gonna not make it perfect, we can't make it back to where it was. We're not replacing cartilage like your joint all of a sudden was back when you were age 20. We're helping repair damage, but we're not restoring and making it a brand new joint, of course. So the regenerative word is a little bit kind of misguiding. But we're regenerating in a sense of repairing tissue, replacing the old. And that's gonna make things more slick, slide and glide,
Yep.
movements are going to take place. That's why we actually feel like inflammation's down, pain is gone, and our joints are moving better.
Yeah, and then with the extra data collection, now we're starting to see some third-party reimbursement for our patients. I know, for quite a while now, if you have a straight Medicare policy, this is a covered option for you. You definitely don't want to delay. If you're suffering with, any limitations, whether it's pain, you're going to want to give us a call. My number listed below. Our clinic is super unique too. It's not just an injection clinic, and we say this all the time. We're a combination of group practice where we have medical care, chiropractic treatment, and physical therapy all under one roof. And you and I say the same thing all the time. These injections, and they continue to get better and better, they're unbelievable. They're going to be the future of healthcare, but they're a great tool in our practice. You got to remember to make sure you're getting to the root cause of the patient's problem. Isn't that the key?
No question. And the key here is we're trying to incorporate other concepts of what else we can do. So we can't forget about our PRP injections.
Right.
We use platelet-rich plasma, where we use the person's own body plasma, take their blood products, spin it down to their plasma, and we re-inject their own plasma, concentrated growth proteins, to allow the body to heal using your own material.
Right.
Same as if we just had a cut or had an injury, the body heals itself. Well, now we're able to do that with the person's own plasma. So we use that type of program for our younger patients.
Right.
And some of our older patients, we will use the Wharton jelly, we will use these type of products. And that way we can incorporate our whole practice,
Right.
getting all types of ages of patients, all type of conditions treated, and get us into our group so we can take care of it from different angles, and from the medical side and the chiropractic side and the therapy side, to get that person functioning.
Total team approach. The best part about it, we take most insurances. For more information about our practice, please click on the link below at maragalmedical.com, and we'll see you soon.
Bye now.